There are many conditions that affect the eyelids, some congenital, some develop as the result of another medical condition, while some occur as part of the normal aging process. Regardless of the reason behind the changes, they can be corrected and improved with surgery. Eye Care Associates is fortunate to have Dr. Augustine Kellis as the Director of Oculoplastic and Reconstructive Surgery, and he joins us now. Welcome, Doctor. So the topic is blepharoplasty, or more commonly known as eyelid surgery. What is it exactly?
Well, there are several conditions that affect the aging eyelid. One condition is the extra skin of the eyelid just continues to evolve and form, and it can hang over the edge of the eyelashes, push the eyelashes into the eye, and actually affect the vision. Now, this can happen in conjunction with actually the eyelid itself drooping. And what blepharoplasty is the removal of the extra skin and the extra fat and reforming the eyelid crease. Sometimes when we do this, we elevate the brows at the same time. I've developed a technique from the inside of the eyelid where I can do that. Other times we move the muscle of the eyelid in addition to lift the eyelid a little bit up. In thyroid patients, for example, we can actually do things to put the eyelid down. But blepharoplasty itself is the removal of the extra skin, the removal of the fat. It comes from two Greek words, blepharo, which means eyelid, and plasty, which means to mold or to form.
Now, you mentioned a couple of examples, but why would someone want, or more precisely need, to have this procedure?
A lot of times patients are very much bothered by the extra eyelid skin. It's a weighted feeling. They need to lift their eyelids with their fingers in order to read. They feel like they don't see well when they're driving their cars. The oncoming headlights bother them. The side vision isn't as good. And what we do, we basically test this ahead of time, and sometimes the insurance companies, if this shows a big enough difference between the eyelids in their normal position and then their elevated position, will pay for the surgery. But basically the point of the surgery is to alleviate all those weighted feelings, alleviate possibly the headaches that the patient is getting. And the last thing, of course, is to improve the superior vision. Sometimes they can gain 30 to 40 degrees of vision from this type of surgery.
Now, one of the first things patients ask is there a risk to this surgery? What is it that someone should know before making the decision to go forward?
Well, I think first of all, as an oculoplastic surgeon, you're first of all a board-certified ophthalmologist. There are a multitude of conditions of the eye that preclude somebody having this type of surgery, and those are all evaluated in the preoperative evaluation. The other thing that we need to consider is, can somebody get off their blood thinners? We work with family doctors, we work with cardiologists, whatever the case may be, to make sure that the patient doesn't have any adverse effect. I would say the biggest two complications that one can have would be, number one, bleeding, which we are very careful with blood thinners. This very rarely happens. And infection is extremely rare on the face because the face has such a good blood supply. I probably haven't seen an infection in over 14, 15 years.
Now, Doctor, you mentioned that you pioneered a technique. Can you elaborate on that?
I was probably the first doctor in Ohio and one of the first doctors in the country to use a CO2 laser to perform this surgery. I've performed probably 60 to 70,000 eyelid procedures with this particular laser. What the CO2 laser does is it's an incredible tool that minimizes the bruising and the swelling that the patients get. Patients don't want to be bruised and swollen for 6, 8 weeks after surgery. And with the scalpel, which is how we all learned initially, that's not uncommon. With the CO2 laser, I typically take out sutures in 1 week, and it's just amazing. A lot of patients have no bruising or swelling at all. And what this does is it actually seals blood vessels as you're going along. It seals lymphatics as you're going along, and the lymphatics actually are what causes the edema or the swelling of the eyelid. Because we can seal all that and I can remove my fat pads with the laser, there's much less chance of hemorrhage afterwards, and there's much less chance of infection, I believe, and there's a more accurate placement of the eyelid because the eyelid isn't swelling like crazy when I'm operating on it. And it also speeds the surgery tremendously for me. There are times where I can get done in 6 to 8 minutes with one side of a blepharoplasty, whereas with a conventional scalpel, that's almost unheard of.
Okay, great information. Thank you, Doctor.
You're welcome.
Now, we spoke with a patient who had this procedure. Let's see and hear how it worked for her, and we'll also see some amazing before and after photos of other patients who've had this surgery.
Well, prior to the surgery, I was noticing for a number of years that I was having a very difficult time reading, especially for long periods of time, because my eyes would get very tired and my right eye particularly would just start to close, and I couldn't read for any extended period of time. I'm a reader, so it was very frustrating, and then by the evening both of my eyes were just so tired that I couldn't enjoy reading any longer. And I began searching for an ocular plastic surgeon. That's exactly what I wanted, someone who specialized in the eyes and who worked on lids, and I didn't want anything to look cosmetic. At the time, I didn't want to appear startled, but I did want something that would at least relieve me of the heaviness in my eyelids and give me a new lease on life. After the surgery, it was interesting because very few people actually said, "Oh, what did you have done?" or "Did you have plastic surgery?" which is exactly what I wanted. Oh, it's wonderful. I can read anytime I want. I don't have to wait or not read at night. I can read all night long if I wish.